My name is Naoki Kurano. I'm a member of the Japan Disability Forum, and one of the members is the Japanese Federation of the Deaf, and I am an executive board member of director of the Japanese Federation of the Deaf. My time is very limited, so I will introduce briefly the issues confronting Japanese people with disabilities in three parts. The first one is facilities for people with disabilities. The second one relates to the care providers. And the third part is about the people with disabilities themselves who receive the services. So let me start with the facilities. First of all, it is not possible for the facilities themselves to handle the COVID situation by themselves. There's a limit. So the care staff, so that the medical sector and welfare sector can collaborate, work together effectively. In the facilities, if there should be an outbreak in a facility, not just the people who are receiving the services, but those also the caregivers might also be infected, and there will be a shortage of the care staff. If the people with disabilities in the residential facilities should be infected, they would have to be hospitalized. But it would be very hard for us to find a hospital who know about the special needs of persons with disabilities. We've worked to try to quarantine them inside the facilities. The living environment will change greatly, causing panic or anxiety for the people with disabilities. Those are some issues that I see. The second one, for the care staff, the care providers, consultation support specialists should take the initiative so that care providers and the medical staff can collaborate effectively. If the care staff or their families should be infected by the coronavirus, or if they come in close contact with someone with the virus, they would have to take leave from work. Or if they're children of the care staff, if the schools or kindergartens or nurseries should shut down, then they would have to stay home to care for their children. So that will create a very large shortage of the care staff in the disability facilities. And for the other care staff to take the work from those that are taking leave from work would be a big burden on the remaining staff. If we try to receive support from other facilities which are better off, but the managers of the facility would fear the risk that their staff members might be infected. So it's not an easy thing to relocate or reassign staff from other facilities. So who is most disadvantaged by this? Those are persons with disabilities themselves. We also need to protect the care providers, though. So we need a good balance between protecting the service providers and protecting people with disabilities. The third point are the people who receive services themselves, the people with disabilities. We should consider facilities for people with disabilities as social infrastructure supporting community life. we need to alleviate the risk of infection by persons with disabilities. If daycare service facilities should shut down, then persons with disabilities would have to stay home. Then they would not be able to receive the same services before, and their body functions would would go down. And also having to stay home would have psychological negative impact on persons with disabilities as well. And it will be a great burden on the families also if the daycare service facilities should shut down. Most disability-related facilities are very small. If persons with disabilities do not go to these facilities out of fear of contamination, infection, then they will have financial difficulties. So we can't, these facilities face the risk of having to shut down even before financially. These facilities might have to shut down because financial reasons even before the coronavirus ends. Besides that, deaf people do not have complete information access. For example, I cannot hear. Every day on television, we hear the administration and the government sends out information on the coronavirus situation, but they're all in spoken speech, so that deaf people cannot receive the information. So for deaf people also, if we go to the hospital, we need interpreters, sign language interpreters with us. However, sign language interpreters also risk the fear of infection. So they might refuse to go. And many people with disabilities are losing their jobs because of the coronavirus. Many persons with visual disabilities have their own small business like massage and acupuncture or moxibustion. But these are all businesses that come in close contact with their clients. So they have had to shut down their business and their income has decreased very much. So the economic situation of persons with disabilities is very, very critical now. And also overseas, we hear of cases where the coronavirus is so widely outspread that the hospitals are overwhelmed with the number of patients, so that doctors have to choose which people to prioritize for life-saving treatment. And they choose the younger ones, and in that prioritization, disabled people are put last, deprioritized in the selection. And so people with disabilities are very fearful, have anxiety about the risk of their lives. Also, facilities shut down. If people with disabilities have to stay home, we also hear of cases where domestic violence happens in the family. So this also is a risk of lives for people with disabilities. Another big anxiety is families that have children with disabilities. If the parents should become infected and have to be hospitalized, Who is going to care for these children with disabilities? That is a big anxiety for these families. So those are this is the situation that people with disabilities in Japan confront right now. In Japan, what we are discussing right now is not just our lives, but our human rights are also at stake. We're at stake of losing, risking our having our human rights taken away. So the medical sector and the welfare sector need to collaborate very closely and support and make a strong basis for the support of the lives and rights of people with disabilities. So we need to back up the formation of this network for the supporting of people with disabilities. Thank you. Thank you for your patience in listening to my presentation.